Hello, my name is Deanna Abel. I'm a bachelor's prepared nurse of 23 years who is in her final semester of the master's degree in nursing with a focus on leadership and health systems. I'm here today to present my Transfer Center Needs Assessment for Eskenazi Health Organization and why we feel it is in the best interest of the organization to create a one-call number and a transfer center for the receipt of patients who are in outside organizations or facilities that are seeking a higher level of care. Eskenazi has a long history in the state of Indiana as the first level 1 adult trauma center and the only burn center in the state that serves southern and central Indiana counties. Eskenazi Health has always been on the leading edge of technology, and they deliver evidence-based practice to the care of the patients they provide care for and see in their facility. Most patients end up at Eskenazi via emergency medical services following some type of an accidental injury. Providers outside of the hospital will typically contact Eskenazi Health with a request to transfer a patient into their organization who has occurred an injury such as a burn or trauma. Unfortunately, due to the growing census across the country, and hospitals across the country are continually going on diversion due to reaching capacity, there is a need for more organizations to be able to accept patients. Eskenazi Health provides great services and a large number of services to all different types of patients and all different types of specialties. It is the need that has been identified for a one-call number to make the transfer smoother and simpler for receiving patients into the facility. Currently, the one-call number that's in place only works for trauma or burn patients. Any other patient that is being transferred to Eskenazi is being done so by providers at outside facilities who are familiar with a current provider in an orthopedic specialist, for example, or respiratory specialist or pulmonologist. Therefore, those providers at the outside facility will reach out to those particular providers that they are familiar with to seek someone to accept their patient. With that being the only method of receiving a patient, you can imagine Eskenazi Health is losing out on potential revenue, increased patient census, and the opportunity for vast growth and development of their organization. When meeting with the Chief Nursing Officer, Leanne Blue, and the Chief of Care Integration, Dr. Charles Miramonte, it was their desire to determine how to create a one-call number or a one-number-does-it-all patient transfer center so that all transfer requests can come into the facility automatically routed to one single number in a designated area within the facility and organization to create a more immediate response time for the outside caller. Currently, this is not the process, and the present process does not involve any organized skill set on how to get patients into the organization. This current process has created transfer delays, a lack of ability to reach someone, and then it has also created a large amount of confusion for those facilities outside of Eskenazi Health. As one of the most extensive and oldest public healthcare systems in Indiana, Eskenazi Health provides nearly 1 million outpatient visits per year between their main campus and also those facilities that reside off the main campus. The health system has continued to create change and innovation within the organization throughout the years since it's been developed, and their primary goal and original customer base was to serve all residents of Marion County, Indiana. Their expansion and growth over the years since the development has extended to the far corners of the state and even outside the state. And today, not only the population of Marion County relies on Eskenazi Health, but also those outside of Marion County and even outside of Indiana. The objectives for this project were to create a one-call number for receiving any patient from any facility outside of Eskenazi Health, to develop a transfer center where the facilitation of transfer requests can occur in a quicker and easier method, and then to create the opportunity for increased census, increased revenue, and increased patient satisfaction, which will in turn expand the services and growth of Eskenazi Health. The background behind why there was a need identified for this was that currently the outside hospitals and providers are finding very irrelevant results when searching for one facility number or one location number within Eskenazi Health to contact when they have the need to transfer a patient. The current process is if a call comes in to the wrong department requesting a patient transfer, the individual or secretary, it could be a nurse, it could be anybody who answered the phone, may or may not have the knowledge necessary to understand the relationship between the clinical need and diagnosis of that patient and the urgency in finding someone to accept their care. The current emergency number that is in place only handles those trauma and burn patients, and it does not provide a connection required for patients who do not fall into one of those two categories. It's difficult for transfer patients to get into Eskenazi who do not fit into a certain box that has been identified as trauma and burns. Therefore, it is the desire of the leadership team at Eskenazi to create a larger opportunity for growth and to create a more streamlined process for getting patients of all different needs into their facility. Dr. Miramonte and Leanne Blue expressed a readiness, they expressed a need for change, and they believe the addition of the transfer center has a potential to foster growth and expand Eskenazi Health, which will create opportunities to reach further corners of the state than they presently serve, and also create growth within the state as far as jobs and so on. So the purpose of this presentation was to streamline a method for accepting the care of those patients who do not fit into the two categories of trauma and burn. We want to create growth opportunities for Eskenazi Health to be a destination facility for transfer patients. And we also want to decrease the confusion for the facilities that are outside of Eskenazi Health when attempting to transfer patients. The ability to maximize the existing resources within Eskenazi Health will create a more comfortable patient flow and not only increase revenue, but also improve the rate of speed and the quality of medical care received by the patient. A new process would also ensure a timely access to the services that Eskenazi can provide and ensure a safer patient outcome by those who are brought into the system. When you have the ability to assign the right patient to the right provider and the unit and bed number during the initial call into one transfer center, you're going to prevent any unnecessary delays due to lateral moves within the facility, due to callbacks, due to transfer phone calls to other departments trying to find that perfect fit. So because there was a recognition and an identification of a need for a smoother transfer of patients into the facility, this was what we decided to focus on for this project. The literature reviewed indicated across the country hospitals are growing and they are going on a diversion at a higher rate due to increased patient volumes and reaching the capacity, therefore having to reject and not having the ability to accept patients when they are notified of a request for transfer. Literature also states that a centralized call number that is ran by skilled clinical providers will provide better patient outcomes. The critical success factors for this project, there were many of those that were identified as a success factor for a new transfer center. One of those key factors for success would be the support of all of the senior leadership team. There must be support to create change, and the necessary change is going to require funding. It's going to require monetary expenses for expansion. It's going to require the approval to hire team members and to staff the new areas. You're also going to need marketing to be involved. Marketing would be a key component for the success and the creation of a transfer center. The marketing team would need to be skilled in communicating this message of a one-call number and a new standardized process to facilities that are outside of Eskenazi Health and across the state of Indiana. Creating some type of a marketing tool that could be distributed to those facilities and maybe placed in their emergency departments or other localized areas where physicians are located, so that they would have immediate access when necessary to facilitate a smoother transfer process and know exactly what number it is that they need to call without having to search for a provider or where to call. There's going to be, like we said, funding necessary to develop the transfer center, the technical support, hiring a staff, and then engaging frontline members is another critical component for the success of a transfer center. Involving those frontline team members, bed placement specialists, internal physicians and providers, and getting everyone on board so that they understand the importance of this project and the need for creating a process that has the opportunity to not only grow the organization, but also create a smoother flow and better patient outcomes and decreased adverse events. The clinical impact is that the outlying hospitals would have the ability across the state to reach out for assistance and have an easier process on getting a patient to the facility. The goal objectives, again, would be to have a smooth process and implement this process so that there is an easier need to get the patient, or an easier method to get the patients into the facility. The tenure, or I guess the strategic impact for this plan would be in a 10-year plan would to see a return on investment by the increased revenue, increased patient census, and increased service lines and specialties that would probably and most likely come into the system because the system is growing and they're going to need to start increasing what service lines they provide. There is a capital requirement that would be necessary in order to get this project off the ground. But again, I think the program impact and success factors would be that increased patient revenue, increased satisfaction by those patients, and an increased revenue that the patients would bring in because you're going to start seeing more patients. The project definition is to maximize the accessibility by all patients. The organization within Eskenazi Health would need to be flexible and adaptable to change. They would want to support the mission and values of Eskenazi Health. So creating a opportunity for Eskenazi Health to not only support their mission and values today, but also to reach back to those mission and values that were created originally when the facility was developed, and supporting all populations of individuals that lived within not only central Indiana, but even outside of central Indiana. Some other project definitions on this would be to decrease confusion surrounding transfers, allowing outside facilities to have an easier method of getting their patients into the facility without not knowing who to call or searching constantly for new numbers. And then again, to increase the growth and expansion opportunities that would exist with a new transfer center. The plan for improvement would be to work with senior leadership for capital requests and approval for the development of a transfer center. We would want to develop a team of skilled clinical nurses to compose that team that would answer the calls that come into the transfer center. Those nurses would need to be skilled in emergency room or in critical care nurses, those nurses that would have a higher level of understanding of what a need and diagnosis would mean and how imperative it would be to move quickly to get patients into the system. Again, we would want to involve internal physicians and providers, and then include bed placement and leadership and frontline staff in the development and process of the development of this transfer center. The transfer center room would be a centralized location again. It would have phone stations that would be monitored by those clinically skilled registered nurses that I discussed with the critical care or emergency room experience. These nurses would be well versed within the organization and the services that are offered within the organization. The RNs would also be supportive, that we would want them to be warm and welcoming to all incoming calls and possess the critical problem-solving skills that are necessary when answering a call under a dire need or a stressful situation. So in conclusion, creating access to the care continuum with multiple points of access through one central number and a transfer center would create success within the organization of Eskenazi Health. There's multiple factors which can contribute to the successful integration efforts of this transfer center. The use of specific principles would allow organizational flexibility and adaptation to changes. Some factors successful organizations focus on are as a part of their plan for reform is the cooperation between the health and social care organizations outside of their own health system. And again, creating the access to the care continuum with multiple points of access is another vital component for success involving the transfer center. Eskenazi Health has already been identified as having in place the necessary parts of a patient-centered philosophy, which focuses on their patients' needs and seeks opportunities to engage those patients to participate in their own care. So by maximizing the accessibility by all patients and populations across the state, Eskenazi is broadening opportunities for standardizing care delivery through the use of interprofessional teams. The opportunity for development of a one-call number and transfer center needs to be further evaluated and reviewed by decision makers to facilitate with focusing on the guiding and integration efforts of the project. In full transparency, I want to indicate that the literature does not contain or support one-size-fits-all process for this model or integration success. So in saying that, I also want to point out that the transfer center, in literature, the transfer center has been identified that it does support better patient outcomes and quicker patient access for those patients who are outside of a higher level of care in your critical access and rural county hospitals who need access to a higher level of care. But this transfer center could support the mission and vision of Eskenazi to provide care to all patients across the state. Some questions you might have would be, where would the finances come from? How would we get the organization on board? Those are discussions that we would want to further with the senior leadership team and do some data analysis of how we could get to where we need to be. There's no real way at this point that was identified to determine what calls and the number of calls that are being missed or how many patients we are potentially losing at Eskenazi Health because we do not have that one call number. But it is believed that we are losing a large amount of patients because there is no one central number or ease of access to get patients into the system. if you have any questions, I'd be happy to answer those questions. My contact information is on the slide presentation, and you can reach me at my email that is listed on that slide. And I appreciate your time and the ability to present this project and work together with Leanne Blue and Dr. Miramonte on this project. And I look forward to hearing in the future if we are able to actually implement a one-call number and see how that affects Eskenazi health and the growth within the system. Thank you.